Okay, I think I'll get started. So welcome everyone to another webinar for the 2024 series for EFPC. For those of you who are not familiar with the EFPC, we are the European Forum for Primary Care. And in a nutshell, we bring together stakeholders within primary care from across the European Union, namely academics, policymakers, practitioners, patients, and informal carers. And they, in order to discuss the organization of primary care and how to achieve the best outputs, the best results, and the best health care for the populations that they represent. So today we will be having a webinar led by Ludmil Ninov, who is the project manager for the Be Well project. The Be Well project, which is co-funded by the Erasmus Plus program of the European Union, is a project that is aiming to promote the upskilling and reskilling of the European health workforce. They will develop a digital and green skills strategy for the ecosystem that can be implemented at a local, regional, and national level, and then ultimately at the European level through the Pact for Skills. So today's webinar will be covering the project strategy to develop green skills, as well as focusing on sustainable healthcare practices that reduce environmental impact and enhance resource efficiency. So about our speaker today, Ludmil is the program manager at EMA, the European Health Management Association, and manages a diverse portfolio. And he manages a diverse portfolio of EU-funded projects, including the Be Well project, as well as acting as primary manager of the consortium. He has a vast experience in advocacy on EU and national levels, as well as hands-on project management of EU-funded projects and capacity building for patient organization and patient advocates. So without further ado, I'd like to hand over to Ludmil for a very interesting chat and webinar today.
Thank you very much, Robin. Absolutely pleasure to be here. And thank you very much for the introduction. You really saved me a couple of slides already. So we're going to go deep dive right away. Indeed, it's a pleasure to be here. When we started the conversation some months ago, I was very, very interested and also excited to do this webinar because green skills for the health and care workforce is a topic that has been very, very popular recently. A lot of stakeholders are interested in the matter, and they would like to know what our project, Be Well project, is doing. So the way that's going to go today, I will present a little bit about the project. I will talk about the strategy. I will talk about what we developed already. And then about next steps, we're going to talk about sustainability in healthcare. We're going to talk about green skills, of course, which is the topic of the webinar, how you can get involved as well. We'll have a slide or two on that. And then, of course, I'll give the floor to participants to ask questions if they have any, and we can have a chat, like you call it, open discussion and then just friendly exchange of best practices because end of the day, what we're trying to do at Be Well is really have synergies. And we would like to hear out from as many stakeholders as possible of their experience, opinion, interest. So I would share with you the slide deck that I prepared. It's a standard slide deck. However, I, of course, made sure that it's really up to date because the project is really changing as we speak. We are now in the midway of the project. 2 years have passed, and the first thing that I would like to pay focus your attention on is the full title of the project: Blueprint Alliance for a Future Health Workforce Strategy on Digital and Green Skills. So this is quite important, and there is a reason why I put the full title of the project here. It's because once you understand the title of the project, then you more or less understand what we are trying to achieve. Definitely, we would like to build, and we already started doing that, an alliance of like-minded organizations that will work on a future strategy for the health and care workforce. And of course, the two topics are digital skills and green skills. Today, we're going to talk about green skills. However, have in mind that we are advanced with the digital skills as well. And if you have some questions on this side, I can maybe do a follow-up on digital skills if that's of your interest, of course. A little bit about EMA. So European Health Management Association is a membership association. We are based in Brussels. We have around 20 people of staff, and we are an amplifier of best practices in the evolution of health management. I started at EMA 9 months ago, and indeed, Be Well is my main project. The program that I oversee is the health and care workforce. And what we do at EMA is we are a platform for complex debates on current health management topics. So these are quite crucial components of our organization. So the vision is excellent health management for a healthy Europe. What we do as a mission, we spread knowledge on effective health management. And of course, these are the 5 values that our organization stands behind. And we try to incorporate these 5 values across all the work that we do in policy and projects and membership and all the activities of EMA. That's the project in a nutshell. It's a little bit of a busy slide, but I'm going to walk you through it. So on the left side, top left side, you can see what's the aims of Be Well. It's a cross-collaborative endeavor. It needs to act as a roadmap that advocates for lifelong learning and continuing professional development. These 2 components are quite crucial, and they go back to the upskilling and reskilling element. And of course, it's an Erasmus Plus funded project, and LLL and the CPD are really crucial components of any Erasmus program or project as well. Be Well will call to policymakers to integrate the needs of the health and care workforce into the design and implementation of policies. And of course, it promotes the advantages of the uptake of digital and green upskilling and reskilling. Upskilling and reskilling, you hear that a lot. These are 2 definitions and then 2 concepts that we use a lot across the project. Then if we go down, you can see the type of partnerships we have. And of course, we have a good blend of different stakeholders, and you can see their logos at the top, at the bottom left. So it's 24 full partners, and then we have 5 associated partners across 11 European countries. And of course, this is one of the objectives of Be Well, really to have this partnership together from across different, let's say, realities in Europe, so we can really see the full, or try to see the full picture across the continent. So the vision of the Be Well project is to prepare the health and care workforce, but also to prepare the health and care ecosystem for the twin digital and green transition. The digital and green transition is here to stay. This is something very, very popular, and it is a great opportunity. According to latest reports, there's close to 1 million jobs that can be created through digital and green initiatives in the EU. So this is basically the vision of Be Well. The mission is definitely, as Robin mentioned, implementation of policies at the 3 levels: local, regional, national, and European. And then you can also see that the values is definitely patient in the center, collaboration, intersectorality, inclusiveness, diversity. We have a lot of comparative research across the different work packages in the project. This is the framework of Be Well. As I said, it started 2 years ago. We are at the midpoint of the project. And what we've done in the very beginning, there was a skills intelligence on the digital and green needs for the health and care workforce. Then we set up the alliance, which produced already the first version of the skill strategy. I'll talk about it in the next slide. And this skill strategy, once we go out to the public and receive their opinions and feedback on the skill strategy, then we will try for implementation on local, regional, national, and European level. And this is all through the European Commission initiative Pact for Skills. for sure you have heard of it. It's quite popular. Last year was the year of skills. The Commission really sees this initiative as a cornerstone. Earlier in the project, we launched a large-scale partnership, and it's open for new organizations to join. It's close to 40 organizations already, and I'll talk a little bit more about it. And lastly, what's really interesting is that BeWell is developing and implementing training programs on digital and green skills, and we've already done this for digital, and we will do now this for green. So you're one of the first ones that we actually see. You have a preview of what we are aiming to achieve with the green courses. So this slide is a bit busy, but what's important here is on our website, you have a skills monitor, which is a repository tool with different digital and green training opportunities. You can see from the slide, this is top left, you can click digital or green, occupation level, the training setting, the language. We have there close to 50 courses available, and these courses are endorsed by BeWell, and they're kept there. So if you're interested, you can already go there and have a look. At the bottom left, you see an example of a course. It's in English, and it's all about sustainable healthcare and circular strategies. So it's available. You can already go check it out if you want, and try to see whether it makes sense for you. We're open for new courses. So if you know another course, if you have seen or done another course, please contact me, and then we can upload this course on the skills monitor. On the right side, you have the skills strategy. And the main aim of the skills strategy is to prepare the health and care workforce and the ecosystem to tackle the future challenges, to make sure that we get more competitive in the highly demanding and rapidly changing labor market, and finally, the upskilling and reskilling of the health and care workforce is really crucial for the health ecosector, but also to support human capital development in Europe. So the skill strategy was developed last year. Now we have opened a public consultation. It's you can see the bottom right corner, and this open consultation, online public consultation, will last for a year and a half. It will be in 9 languages, English plus the languages here that you can see in the flags: Bulgarian, German, Dutch, Italian, Greek, Norwegian, Romanian, and French. And the objective here is to take your opinion. We built this questionnaire to take your opinion on how we can improve the strategy. You have the full version uploaded in all the languages, and we also summarize it in 3 pages for those who prefer to have a short version of the strategy. And then once you read it, you answer a few questions. And this is one of the ways that we will do consultation. These are the 10 courses we developed already in digital skills. You can see the target groups in brackets. You can see the different type of courses. Some courses are more for entry level. Some courses are more advanced. It really depends on the different profiles, and really depends on the different countries, because some countries are more advanced than others in implementing digital skills across universities, hospitals, healthcare facilities, etc. This has been piloted with 90 people, and all of this is available on the BeWell YouTube channel. There are, of course, short videos, and then after each video, there are questions that you can answer. We will do the same for green, and now I'll show you a little bit more about what we are aiming to do with the green. Before that, last slide on the large-scale partnership. So we have more or less 40 organizations. You can see the logos here at the right side of the screen. We're open for new partners. So if you're interested, together with Eurega, we are co-leading the large-scale partnership. There are 3 large-scale partnerships under the Pact for Skills. Ours is the one for the ecosystem. We have one for the pharmaceutical industry, and the last one is for the long-term care. So these three large-scale partnerships, they are trying to support the transition to green and digital economy, make sure that the EU health systems are more competitive, and of course, make sure that Europe's is more autonomous. They're under the Pact for Skills. It's a European Union initiative. And just for you to know, there are large-scale partnerships in textile industry, in tourism industry, in automobile industry. So for health, we have three. There was an idea to have a fourth one on intensive care units. Still, it's in draft. If you're interested to join the partnership, please contact me, and then I can explain everything about it. We meet once a year in person. The majority of times we meet online. We have different activities, different working groups, and we hope after the end of Be Well in 2026, this large-scale partnership will continue to do activities, various activities accordingly. Now, with this was the overview of the Be Well project. Now I'm going to deep dive on the topic of today, and we will talk about green skills. First, I'll start with a very generic slide, and this is a lot of people, when they hear green skills, they're wondering what we mean by green skills, and also they're wondering what do you mean green skills for the health sector. So on the left side, you see the definition that we use in Be Well. So green skills are knowledge, abilities, values, and attitudes needed to live in, develop, and support a sustainable and resource-efficient society. So this is the definition we stand behind, and it's quite broad definition with a purpose, of course, because we would like to be capturing as many elements as possible, and then at the same time we realize that the concept is quite complex, and you need different stakeholders and different target groups to be involved. There's another definition at the bottom, which I included just for more clarification. So basically, green skills can range from very technical and job-specific skills to softer skills, and so there are some examples when it comes to using resources, or when it comes to different occupations, hierarchy, and sectors. This is something quite important, because end of the day, we know that green skills are, of course, very prevalent when it comes to the hospitals and the hospital settings, and that's why I put building at the first place. But then they're also crucial when it comes to services, when it comes to healthcare services, and of course, finally, when it comes to people. And by people, of course, health and care workforce on one side and patients on the other side. So these are the, let's say, the three target groups. Again, very broadly speaking, and we will talk about them in the next slides. So when we talk about sustainability in healthcare, again, a small definition here for you, and it's something, again, it's quite broad, but in a nutshell, sustainable healthcare is really an approach to healthcare that prioritizes environmental sustainability alongside health outcomes for patients. Then it is all about implementing green practices across medical sector to minimize the negative impact on the environment and promote efficient resource consumption. And finally, in order to implement these processes, training of the health and care workforce is absolutely necessary, fundamental, mandatory. So in order to achieve sustainable healthcare, we need to train the health and care workforce. Hence, Be Well is making courses for the health and care workforce members. These are the three top green skills that we identified. So we have cognitive competences, interpersonal competences, and intrapersonal competence. They're, of course, really linked to each other, and it's all about, when we start with cognitive competences, it's all about skills to access, interpret, and understand both the need for change and what measures are required. interpersonal skills, it's really about coordination, management, and business skills to facilitate the holistic and cross-disciplinary approaches when it comes to economic, social, and ecological objectives. And finally, the interpersonal competencies is the adaptability and traceability skills that help workers learn and apply new technologies and processes. So we focus, our courses that we are developing are focused on these three categories of green skills. This is the structure of the courses that we are preparing now. So you're seeing it for the first time. This is the topics that will be part of our green skills courses. And you can see that we'll talk about the definition of green skills for the health sector. We'll have some case studies. Then we'll talk about the Sustainable Development Goals, and we'll talk about One Health approach, which is again the human health, environment, animal health working all together. As you know, it's quite famous concept in the last few years. Then we'll talk about how healthcare providers can preserve environment, how to have safer pharmaceuticals. Of course, the topic with hospitals, hospital buildings, and how to what's the impact and management of the waste is a crucial topic. There will be a topic about urban health and what's the role of hospitals in maintaining it. And finally, there will be a few case studies on the next generation hospital and urban health and therapeutic landscape design. So these topics will be part of the course. And again, we'll do as with digital short videos, a few questions, short videos, a few questions. It will be in English, and then eight languages as subtitles. Initially, this is the plan, and from there, I'll tell you how you can get involved. But before that, quite important to talk about green certification, and it's already happening. And this is why I put this slide, just to let you know that the NHS in England are already doing that. So really, we're talking about the promotion of sustainable and ethical food choices when it comes to implementing it on the hospital level. We're talking about adopting standards that are really aiming to improve the food quality, the provision of high quality, nutritious and sustainable food for patients and for visitors. And this is just part. This is one of the, let's say, one of the first case studies, which is aiming at improving patient care, staff well-being, and sustainability in general. And I chose food on purpose, because when you hear green skills, a lot of people think about, okay, we have to put solar panels on a hospital. Okay, that is correct. That's true. But I'm starting from this case study because it's quite crucial, and it's easier to implement. And of course, it's something that it's already happening in England. So this is just a case study from the NHS, and of course, this hospital they received the green certificate when it comes to sustainability in health. So how you can get involved? Now we are developing the courses. We will pilot them, and you're welcome to be our test users. There will be a platform where you receive a password and a username, and you can test the courses depending on your interest. As a reminder, you've seen the topics are here. So depending what you're interested in, you can really go into one course, one topic, see the content, see the videos, answer the questions, and then provide us with feedback. We really need this feedback in order to make the courses a success. Of course, then we'll work on your feedback, improve the courses, make them available to the public. And at the same time, the digital and green courses, we are aiming at accreditation and certification for everybody who does the course, we would like to make sure that there is a credit system, like there is a credit that everybody can receive, and of course a certificate as well. So with this, I would like to wrap up my presentation on what BeWell is doing in terms of green skills. This is the website. Please visit it. As I said, there is the online public consultation going on the skill strategy. You'll find everything there. There's plenty of materials in a lot of languages. You can already use those. They're available free to the public. And thank you very much for your attention, and I'm really hoping for a few questions from your end. It's been a pleasure, and really looking forward to the discussion. Thank you.
Sorry. Thank you very much, Ludmila, for that presentation. And just to open up to the floor, anyone with some questions at the outset? And just raise your hand, or yes, Dedrick.
Well, in the case that nobody else wants to start up this discussion, Ludmila, thank you very much. Of course, we met in Dublin already about the topic, and was nice with a small audience at the European Public Health Conference. And then I told you already the story when you say about food. We organized a conference in Barcelona, I think you remember, and I told you the story. Well, they wanted to be sustainable, and they wanted to reduce the paper use, so less paper, smaller printed programs. But if we started to talk about the dinner and having less or no meat in the conference dinner, well, that was way too far, of course. So it's very much cultural directed. I mean, you have all these cultural differences. Just that as a remark on the food choice. I would say where there is a much urgent, more urgent thing is the pharmaceutical intake. If we look at the scale of pharma intake, which is not needed, which could be reduced a lot on drug intake, there I think we should act even more urgently, and in particularly in collaboration with the European Commission, which has also an interest in selling more drugs. So let's see what can you give your impression on this topic of urgency?
That's a great starting point. Thank you very much for it. When I speak to hospital managers, a lot of them are asking me about the building component and the solar panels, and they're asking me about how to make the hospital more efficient and more energy effective. But what you're saying about the consumption of medication is absolutely a crucial point, and it is part of the awareness campaigns and the courses that BeWell will develop. Definitely a component, and this is something quite important, especially in a day and age. And again, you're so right, cultural. It's very cultural. In a lot of cultures, it's very, very usual to consume medication that most probably is not needed for you. And this is a problem that indeed we need to reflect on. In the courses, we are definitely going to focus on this, and that's why we put the way forward to safer pharmaceuticals. This is one of the 10 videos that we'll have. One of the 10 courses that we'll have is this, and it's interesting that you're highlighting this, because the reason why I put food, because it's something quite I would say, as I said, easy, straightforward, and it doesn't, of course, it brings some challenges, but it's something that can be implemented right away. As for the pharmacy, for the point on the medication, we need to change the perception as well. We need to change the perception, and it goes down to culture, but also it goes down to health management, and it goes down also to awareness and to different campaigns, and that's why Be Well will focus on safer pharmaceuticals as a component of the courses.
Did you try to cooperate or to get the support of the EMA, the European Medicine Agency, in this? Because I think that would be crucial in getting this off the ground.
That's a good point. We are going to have at the end of the year, we'll have an event in Brussels, and now you're giving me an idea to invite somebody from EMA. Personally, I have worked closely with one of the few people from EMA over the years, patient advocates. But in any case, we can definitely invite. We can invite a few representatives and raise this point, because it's crucially important we act on that as well.
As a partner in Be Well, we could, and being one of the members of the health professional working party of the EMA, we could suggest that we open up the opportunity for the courses through the EMA. I think that should be possible. There's nothing against it, I think, to have the EMA as a dissemination authority to get more participants in these courses.
Absolutely, and realistically speaking, what we're trying to do is really to have the courses implemented across universities in Europe, and of course, EMA is a great amplifier, and it's a great promoter, and we can definitely think of a collaboration with them, and I believe that it will be also in their interest, because end of the day, the plan, to my understanding, is of course to have a European level skills strategy. So the European Union and the European Commission has a very strong interest in that. So I think EMA can also play a role, and we can join forces. So synergies is crucially important.
Okay, thanks.
Okay, first there's some comments in the chat. We'll address those, and then Rodney will take your raised hand. So Rahil from the Victoria Consultants is asking, how can they, because they're Pakistani, how can they get benefits from this organization, and are we able to help Pakistani hospitals, and how can they attend and apply for these courses?
So courses will be available to the public online. There will be a platform where you can register, and you can basically do the course and then get a certification, and get some micro credentials for them, which is quite important for a lot of health and care workforce members. So everything will be available publicly. We are now doing the digital ones. They will be distributed. We have them on YouTube, but they will be also available on a platform. And then the same will happen with green skills, perhaps by end of year. So next year, everything will be available in a package early next year. And hopefully we can also introduce them to a few universities across Europe.
Thank you for that, Ludmil. Rodney Morton, your hand's raised.
Yeah. Thank you. My name's Rodney Morton. I'm Deputy Director of Nursing for Sustainability and Innovation in NHS England, and I just really want to pick up the conversation that was around medicines, and particularly here in NHS England, you'll be aware that we've done quite a lot of work around medicines optimization. So there are a number of case examples that will help at a clinical level to understand how we can introduce greener prescribing practices as well as a more effective management of medicines. So for example, we have a strong focus in our program around well-being optimization for patient clients.
Sorry, I think we're struggling. There's a bit of a connection problem on your side there, Rodney.
I think we lost Rodney almost.
Yeah.
His video is switched off. Maybe we give him another chance later and we continue with Sven.
Yeah, Sven? I think you're on mute.
Yeah, this works. Yeah, hi, I'm representing two networks, ESPA, the European Federation of the 1,400 Medical Revalidation Spas. And we also do the measurements of the aviation pilots. They have to reactivate their flying licenses by undergoing a full body and brain scan every month or semester. Because of course you don't want your pilot to have a brain infarctus or a heart infarctus at 10,000 meters altitude or whilst landing. I was wondering if you already have something on the new European, if you're linking up with the European Union, new European Bauhaus program.
Can you elaborate a little bit more on the program? To my knowledge, no, but I have another 20 colleagues in the in the team.
Yeah, I think I will just start emailing that because there is I think in your course you should also have links to the EU, the fact that we now finally have a Director General of Health and that we're building an EU Health Union. I think, as you mentioned before, already also put links to the Director General of Energy, the Director General of Transport and Mobility, so that students don't panic and don't underestimate the work and the programs that are being developed there. There is also the EU program for urbanists on climate change adaptation to make our climate resilient and to make our cities also more healthy. The 15-minute walkable city, for example. On collaboration with improving food in hospitals, yeah, we with our medical revalidation spas, we are of course very much into. We have in every medical spa hospital we have nutritionists who know about healing with food. Yeah. I think we also have to make links with the European Institute of Innovation and Technology Transfer, the EIT. They have a whole program on food and healthy food innovations that they try to get into the market. I think we also have to, yeah, we also are in the EU program on personalized medicine. Yeah. For example, our aviation pilots, we have personalized medicine in the aviation industry, for example. So that could also be interesting. And then ESCO, the European Skills Codification System, that is more than 350,000 codes together with a skill. And that way, recruiters can understand better what kind of person has what kind of skills. And I also want to link up with the European electronic badges system that we support in Erasmus Plus. So that, for example, to link up with the persons who are from other regions, for example, you can have, after following a massive open online course that we make, you can really get an electronic certificate when you pass the test, and that in Europe that automatically integrates in your Europass curriculum vitae, for example. And
Yeah.
then also we have to develop an electronic flashcard disk for accelerated memorization. Yeah, that's voila. So these are the couple of points that I would like to help out with, and I can help out with. So I'll just email them. So voila.
Yeah. So excellent intervention. Thank you very much. Please indeed reach out to me, because we are now at this stage where we are developing the green courses. We are starting to work on the videos. Everything will be recorded. We will put everything on a platform that can be tested with end users for maybe 3 months, I would say. Digital courses are already developed, and I can also reshare with everybody what we have available. And what you listed here just really made me thinking about across discipline, across sectors, really cross collaboration. And this is what Be Well is all about, and this is what the large scale partnership is all about, that we are running together with Eureka. End of the day, we would like to have these courses implemented, and we would like to touch base with different partners within health. Sometimes also beyond. It goes beyond, because when I talk about green skills environment, we talk with other NGOs outside health, but which are indirectly related to health. So please reach out to me, and we can find a way to collaborate, and we can find a way how we can really cross fertilize our activities.
Sven, would you be willing and able to at least some of it, what you mentioned yet, to put it in the chat box, so our participants can take note of it?
Yeah, sure, of course, yes.
So, Rodney, do you want to just continue with what you were saying?
I put it in the chat box in the hope that I don't lose connection. But just very briefly, some of the work we've been doing around particularly medicines optimization, and particularly around respiratory care. There are a number of really good case examples that show how clinicians adopting a whole person approach, maybe building on the sort of personalized medicine agenda, can engage in much more greener prescribing. So, for example, in our respiratory pathways, working with citizens who've got asthma, and two elements to that. One, really paying attention to what prevents a deterioration in the condition, and secondly, using more greener medicines. So, for example, using DPIs rather than MDIs as part of clinical practice, and we've made huge progress in this space, particularly in primary care and in our respiratory clinics. So just really stressing the importance of using those evidence-based clinical pathways that demonstrate how clinicians can engage in lower carbon care and greener prescribing.
Okay, thank you, Rodney, for that. And then I see Eileen Barrett, you had a question about what specific Irish collaborations there are in place. And you could see an organization from Ireland, that's ECH Alliance.
Yeah, they're a pan-European organization. Yeah, registered in Ireland.
Yeah. Tim, you had a question?
Yes. Thank you for your presentation. I have two small questions. In urban health, you mentioned the role for the hospitals, and I'm wondering if you are aware there's also a great role for public health and primary care. Are you taking that in advance also in urban health? And the second is about
yeah.
Yes,
no, go ahead.
Answer first. Yes. Yeah, you can answer first.
Okay, yeah. Let me just show you this slide, which was quite important. So here on the slide, you see on the right side, you see an ideal hospital in the future. You see the solar panels, you see the different green elements. It's also quite a holistic approach. You see also all the members of the health and care workforce working together. And on the left side, you see what we are trying to achieve with the green skills. And these are the categories, the 5 categories in a hospital. In this case, okay, we put building. It could be a healthcare facility. It could be a laboratory. It doesn't really matter. But the point here is, so we have the quantification and monitoring. We have the management systems. We have the procurement and selection of goods. Of course, the minimization of what we use, and finally risk assessment when it comes to different activities in the facility. So I don't know if this answers your question, but I think it, to a point, it does, because you see that it's a really it's a holistic approach, and a lot of stakeholders are involved, and a lot of different components play a crucial role when it comes to the building element. And what's the second question?
Yes, I think that explains a lot. Thank you. And the second question is, well, I assume you are aware there is a different speed in Europe in being green, becoming green, and I wonder if your courses are also a kind of differentiation in of taking care of for this differentiation. There, before I'm from the Netherlands, and solar panels are quite common, and that's not in all part of Europe. So my short question is, there are some different speeds, and do you take care for that in your courses, that no blueprint for all Europes in your courses?
Yeah. Excellent point, Wim. Thank you very much for this. We recognize this already in the digital skills courses, and maybe I can share once again the list of courses for digital, so you can see them. In a nutshell, what we are trying to do is really have a little bit, let's say, more. I don't want to call them basics, but let's say different levels, because when it comes to green, as you pointed out correctly, and when it comes to digital, so both green and digital, they are on different levels across the continent. So that's why here you can see in the digital skills, some of the materials are quite, let's say, entry level, maybe let's say increase Office and Google Suite knowledge for nurses, health assistants, doctors, technicians, admin, management members, but some of them are a little bit more advanced. So let's say cybersecurity in healthcare, it's a little bit more advanced course. Now, when I speak to hospitals, hospital management, and just in general staff working in hospitals, there are 2 things that I receive. The first thing is there is usually an IT support at the hospital, and the IT support told me, these courses that you developed, I know everything, I know all of them, so most probably it's not gonna benefit me. I said, okay, but how about the people that you help in a hospital? How about the nurses, assistants? And he says, yeah, or she says, yeah. They do reach out to me because they are still lacking certain skills. So we are aiming to have some advanced courses, some entry-level courses, and some really, really advanced courses. But even the really advanced courses, I already spoke to a lot of people that are IT, let's say in the digital case, across hospitals, and they say they know all of these and beyond, because there is a lot of attacks on hospital, like virus online hackers trying to attack the databases, and the IT people at hospitals, they need to be equipped with the best skills possible to reject these attacks, to eliminate the risks. So yeah, the short answer is yes, we are taking into consideration the different levels, and I gave you an example. I see Sven has I hope.
Thank you very much. Yes.
Yeah, I hope it was clear. Thank you.
Yes.
May I just intervene also in this one, Ludmil, in the sense that I'm not aware how much the entry courses are, because I can imagine, related to the question of Wim, that there are really parts of Europe and parts within regional diversity, also within countries, that there are places, if you talk about the greener skills, that they are really at bottom level, that people are not aware of any problem at all. I mean, that occurs, I think, and you have to take it into account if you, and there you might have the biggest gains even starting up the process of thinking about greener skills.
Yeah, absolutely. No, you're absolutely spot on, and that's why I gave an example with the digital skills, because first of all, we are almost there done. We are more advanced there, and everybody sees the added value, and it's easy to talk about digital, easier to talk about digital than green. And you're absolutely right. In certain environments, people still need awareness. People still need a change in like a mind shift. And this is absolutely the case, and this is a very good point, because this gives us the feedback that some of the courses we develop in green, they have to be really explaining the added value. They have to be explaining what we mean by green, how we, and that's why I gave the example with the food, because it's really it's a bit more comprehensible and understandable across the continent, because also healthy eating, healthy habits, it's everywhere in these days, and it's a bit easier for everybody to understand what we mean by green. Of course, it's not only the food, as I already explained. It goes beyond that. It's much more complex than that. But we'll take into consideration the fact that there are disparities across the continent, and in some environments, in some regions, the green element is neglected, and that's why we need to change the mind, and we need to make a BeWell into a movement to this green and digital transition in Europe, because it's inevitable. It is here to stay. It's happening. It's going nowhere, and then we have to adapt. And I think this is what we are the best at as human beings: adaptation. Sven.
Yes. Have you also? Is there any from ESNO, the European Specialized Nurses Organization?
Yeah.
Because I've been working with them on their strategic management plan. They first did that together with the World Health Organization, and then the European World Health Organization branch, they helped them to translate that into a mission statement and a strategic plan. And I remember indeed that they also have been developing courses on green skills. And one of the elements that I haven't heard here yet is that they also saw, as medical nurses, they saw the patients who were climate change victims, or victims of, for example, chronic lung problems, so not sustainable green cities, making children sick, for example. They have the children in their beds. And sometimes, and what they understood also on these green skills was also to have feedback mechanisms straight to the people responsible in their city on dealing with all these matters, because very often politicians, even local politicians, they are not aware of it's abstract. But when you are a medical nurse and you have children who are really sick with chronic health issues, or who are obese, for example, suffering from diabetes, then things become much more concrete. If you have elder people, for example, during a hot summer, for example, and they are really dehydrated, and you see the effects of climate change, they want to have systems also to feedback that, even take pictures, so that these decision makers see that, listen, all your nice decisions and your and so forth, we don't see it always that clearly on the floor, and we want to give feedback on that. Have you also picked something up like that?
Yeah, so they're part of both the project Be Well and the large scale partnership, which Be Well started and its funding. And we had a couple of webinars with them, meetings with them, and their viewpoint is very much reflected on the courses and in the project, and also it goes beyond in the large scale partnership activities that we are doing. So they are a very important partner, and we are in a weekly communication with them.
Great. Thank you. Is anyone else with any further questions, comments? Thanks once again to Ludmil for a very informative presentation, and thank you to everyone for joining. And please register for our next webinar, which will be on the 18th of July, which will be looking at AI in healthcare. But please visit our website for more information.
I'll register. AI is very important.
And don't forget about our conference, which is about, I wanted to put it in the chat, but I made a mistake, which is about sustainable primary care in all kind of directions, but certainly also on greener primary care, but also on sustainability in having good care on the long term. So join us in Ljubljana on the 15th to 17th of September if you are interested in the topic. Okay, thanks a lot. Robin, thanks a lot for chairing us for this. Very well done, and hoping to meet everybody soon. Bye bye.
Cheers. Thank you.
Thank you very much for the invitation and for the attention.